To incorporate the expert opinion systematically, we chose a panel of 27 external reviewers, mainly dermatologists or practitioners involved in the management of associated comorbidities, and there were also patients. And this panel of reviewers had to validate the recommendation with a scale from 1 to 9. And if at least 80% of the reviewers gave a score of 7 or more, the recommendation was retained. Otherwise, the recommendation was discussed again with the working group and possibly modified before being resubmitted to the reviewers. So everybody had to agree the recommendation for the recommendation to be accepted. And one of the most challenging aspects was the choice of the first line of systemic treatments for patients without comorbidities. Dose reduction strategies can involve reducing doses or increasing the interval between doses. Dose reduction could offer potential benefits by decreasing the risk of adverse events and reducing the burden and costs of biologics. This strategy should be considered after at least 1 year of treatment if the disease has been in remission or has shown low activity for several months. Of course, the modalities of dose reduction must be discussed with the patient, taking their preferences into account with a shared decision-making process. And patients must be informed of the risk of relapse associated with dose reduction, and patients have to accept it. So there is no guidelines for the rhythm of consultation after dose reduction, and this should be a case-by-case process. The scenario with the greatest complexity was for a patient with a history of cancer or active cancer. And we wanted to do recommendation for these patients because it's a very frequent situation in daily clinical practice. And we think that dermatologists need to have guidelines for managing patients with cancer. And in this recommendation, we suggest the maintenance of biologics or apremilase for patients with cancer occurrence or relapse under treatment, which is quite new. Of course, this is a case-by-case suggestion, including discussion with the oncologist and the patient with, again, shared decision-making process.